arriving and there's vulnerability to influenza. So the influenza campaign has kicked off in Europe, and that's why this webinar is so timely. The main reason for this webinar is really to have the experiences of the speakers, get insights from them. We have a very interesting and diverse range of speakers on this webinar. I was very pleased to be part of the ESNO Congress in Milan, and then I was learning about this association and also the fact that this association has come together with a joint position paper on all of this issue. So a very, very sort of well-organized approach to promoting the value of specialist nurses. On this webinar today, we have four speakers: Joris Vugt of Viatris, Dr. George Castellanos from ESWI, Bear Omen from ESNO, and Rebecca Moore from Women Health Europe. There'll be lots of time for debate and exchange. So if you have any questions, there is, as you can see underneath your screen, a question and a chat box that you can participate in. You can also just put up your hand and join the discussion, and we would very much welcome your input today. We are recording this webinar, and we'll be doing some promotion about that later on. And we also are giving you the opportunity to participate in the debate with a poll. So thanks for joining that. And with that, just for a brief kickoff of the discussion today, we're going to move to Joris. Hi, Joris. You want to say something just to introduce the webinar? Go ahead,
Hi,
Joris.
Paul. Yes, thank you for the opportunity. Good morning, good afternoon, everybody on the call. My name is Joris van Vugt, and I work for Viatris, the sponsor of this event. And I'm a senior medical director working for a medical affairs organization. And what I do within our organization, I work on strategic partnerships with stakeholders in the healthcare environment to work on addressing public health needs in Europe and globally. And yes, thank you for the opportunity to share some welcoming words, Paul and Bech and everyone else involved. So a slight introduction to Viatris and also how we've been collaborating with ESNO over time, and why I think it's so important to have this webinar and this broader educational project on vaccination for nurses. So Viatris, we are a global healthcare company, and our mission is to empower people worldwide to live healthier at every stage of life. And of course, we do that as a pharmaceutical company by supplying high quality medicines to patients around the world. And we actually approximately reach 1 billion patients annually with our medications, including vaccinations in different therapeutic areas. And of course, to ensure that our medicines address appropriate unmet needs and we reach the right patients at the right moment in time, we collaborate with multiple stakeholders in the healthcare environment, including patients, payers, academia, civil society, governments, and HCPs, including nurses, of course. So having this global network with all these different stakeholders, it gives us the unique opportunity to drive partnership projects and work in unison with common objectives to impact, as I mentioned before, unmet public health needs. For example, through tackling health inequities, supporting care integration, and also invest in capability development of the healthcare workforce. So we have a long history collaborating with ESNO, working together on, I think this is very important, formalizing the role of the specialist nurse and raising their voice within the European healthcare community. And also harmonizing education, which is important from a sustainability perspective as well. In addition to, and this is what I've mentioned before, the development of capabilities of specialist nurses. So we are working on many different projects, including the NCD Academy. We work together on different medical education events, and we also support scientifically generation of data to support activities, specifically for vaccination and nurses, we supported ESNO with the development of a paper on the nurse perspective on vaccination. And we are currently, and we've recently submitted a manuscript that looks into health inequities that exist in Europe related to adult vaccination. So in general, I believe that the specialist nurse should play an important role in vaccination to reduce the existing coverage gap in Europe between recommendations and clinical practice. And the reason why are pretty obvious, but I wanted to mention a few anyway. So first of all, research has showed that people seek healthcare professionals' advice and expertise regarding knowledge and their doubt, assistance related to vaccination. Obviously, nurses, specialist nurses, are in daily contact with patients and have that privileged communication channel. Also, opportunistic chances to vaccinate people in the healthcare setting, I believe, are frequent among nurses. And what we've learned from the expansion of the role of pharmacists as vaccinators in Europe, this led to excellent results in terms of coverage, proximity, and quality of service metrics. So there is definitely space to expand this role to other healthcare professionals, obviously focusing on nurses. And that's why I'm very happy to support the European nurse curriculum on vaccination initiated by ESNO. And that's why I'm always also looking forward to this exciting webinar. Thanks for the opportunity to introduce this event on behalf of Viatris.
Thank you very much, Joris. Very interesting to hear about the scope and the scale of the influence of your company, but also your willingness and clear support of ESNO, and also very strong understanding of the mission and the focus of ESNO in promoting specialist nurses and also harmonizing education. So thank you very much for that, and thank you very much for supporting this webinar. Now we want to move to a GP, Dr. George Cassianos, but also a very well recognized expert in the field of infection. So thank you for joining us today. Dr. Cassianos, you have your presentation shared and ready to go. So I give the floor to you.
Thank you. Thank you very, very much. And really, my thanks for allowing me to be with you today. It's such an important meeting to talk about the role of nurses, new directions within policy and political choices. I think everybody is aware of why do we need to actually vaccinate against infectious disease. And of course, the benefits are to the individual very much because vaccination protects against severe disease, against hospitalization, admissions to the intensive care unit, but also death. Then is the problem of antibiotic resistance, and protection against antibiotic resistance is extremely important. We need to prevent the infection. We're going to hear a lot about antibiotic resistance from the WHO now because it is actually something that we need to talk and discuss. Then is the protection of the healthcare system in our country. And of course, we decrease the number of people who are susceptible to infection, otherwise called herd immunity, and we reduce the absentees from schools, from universities, from work. There are three foundations for a successful vaccination campaign, influenza or otherwise, is the government, patients, and primary care, and the three need to actually gel together and work together. And in primary care, nurses are on the top of my list. There is doctors, and of course, the pharmacists. Now, I'm going to show you in 2 slides what we have achieved in the UK, not for any other reason, but to actually point out that without the nurses, not even half of this would have been achievable. You can see there, the 65-year and over, we have got the WHO 75% and above vaccination rate. In the last 4 years, we have achieved well above that. In the EU, there are 2 countries that have done so too, Denmark and Portugal. And we have got those in the groups at risk, about 41%. Pregnant women, unfortunately, we have dropped down to 32%. And that's a problem that in whole Europe we're actually facing. And healthcare workers, about 43%. But here are the children. the 2 and 3-year-olds are vaccinated in primary care. And this is where the nurse plays an extremely important role, because she's the one who vaccinates, he or she. And we achieve about 44% vaccination rate of our children. And the school services go into schools to vaccinate, and that's primary age school children, 55%, and about 43% for the secondary school. So who are the vaccinators in the UK? Primarily is the GP practice nurse. They run the vaccination clinics. They run everything about vaccination. Now, the GPs do vaccinate, but really more opportunistically. Also, when we do mass vaccination, say on a weekend when we open, we have GPs there and they vaccinate. But it's the nurse that really vaccinates. Also, I would like to actually introduce something that already some countries in Europe have taken over and run, and that is actually the involvement of the pharmacies in vaccination. And we have the school vaccination services, which are nurses that go into schools and vaccinate children who are at school. Now, a nurse needs to be safe, and therefore personal insurance, professional insurance, it's a must for a nurse to actually have in the practice where he or she is working. And of course, there has to be really standards that the vaccinators achieve, whether they're GPs, whether they're nurses or pharmacies. And here we have got the Royal College of Nursing, which has now issued the 3rd edition of the Immunization Knowledge and Skills Competencies Assessment Tool. Very important tool, which actually describes exactly what a vaccinator, a nurse, really needs to know, what skills they need to have, and so on. Also, a nurse needs to be involved and be well trained in vaccinating children, but also vaccinating adults. And in the UK, we are very lucky to have the Green Book, which takes all infectious diseases and talks about the infectious disease, but particularly vaccination about that infectious disease. And this is a tool that the nurse needs to really know well, read again and again whenever it's needed. That's what we also do. Then we have got the national minimum standards and core curriculum for immunization training for registered healthcare practitioners. And again, there is a need to have that minimum standards of training for anybody who is a vaccinator. There is here a list of competencies for influenza vaccinations that we need to meet, whether we are GPs, nurses, pharmacists, and so on. And here also are 8 pages of influenza immunization training. In addition to that, a nurse can go on the web and do the e-learning module, very important in actually training, so that in September, he or she starts vaccinating patients against influenza and other diseases. In the UK Health Security Agency, that's Public Health, also supplies us with a PowerPoint, 95 slides available to anybody who wants to actually connect onto that website. And it's for training, but also we can use those slides in lectures, in training, in anything. Very important for a nurse is the patient group direction, PGD as we call it. Now, PGD, you can see here the 2 vaccines. We have the inactivated influenza vaccine and the live attenuated influenza vaccine we are using in the UK. And a nurse needs to know everything about the PGD. It talks about who should have the vaccine, who should not have the vaccine, why. All aspects of immunization are actually in the PGD. And then the nurse will sit with a senior clinician, discuss this, and then they will both sign that he or she, the nurse, is competent to administer vaccinations. In addition to that, we get information back from the government. It's a weekly report which goes throughout the year, and it's about COVID and influenza. It can run from 10, 14 pages to 60 pages during the pandemic and so on. So information coming back to the vaccinators is very important. And the nurse has a plethora of leaflets to be able to give to patients, particular age, particular problems, parents. Also, all these are available on electronically to put on the website of the GP practice or the pharmacies. And they're available in many languages, up to 30 languages. Not only that, they're available in audio, braille, British Sign Language, symbol text for those who with low literacy, easy read for those with learning disability, and large print. What I'm really saying here is that it's not enough to have the nurse fully qualified to and trained to give vaccinations, or the GP or the pharmacist. You need to support them. And the way to support them is to, in many ways, but one of them is to actually give them that education for the patients to put forward to educate well their patients. And here is my tribute to pharmacists. In the UK, we involved them back in 2015-16 for the first time in that season, and they administered just over 595,000 doses. But you can see that in the year 2022-23 season, 5.5 million doses of influenza vaccine to eligible for NHS-free vaccination. This does not include the private vaccinations the pharmacists have also given. And last influenza season, 3.8 million doses. Now, you remember we started vaccinating against COVID on the 6th of December 2020. Mrs. McKinnon received the very first COVID vaccine. Now, within a year, just over a year, by January 2022, the pharmacists had given 22 million doses of the COVID vaccine. So it is a force that we need to bring back in Europe and really allow them to vaccinate. And finally, I wanted to really remind you what the European files actually point out. They point out that the healthcare professional, the nurse, GP, pharmacist, serve as the most trusted advisors and influencers of vaccination decisions. But they also say this, that a lack of knowledge among healthcare professionals is considered one of the most important factors for vaccine hesitancy. So a nurse is not there just to vaccinate. The nurse needs to be also very, very well informed about vaccination and very well trained. So as I finish, I think I can summarize by saying well-trained nurses play a really, really most important role in promoting and carrying out vaccinations. Without nurses in the UK, we couldn't have done really much of what we have achieved in vaccinations. Nurses are the main vaccinators in the UK. We'd like to thank you very much.
Thank you very much, Dr. Castellanos. I have to say, an extremely clear presentation. One question that comes to mind. So we have all of these resources in the UK. Does the same level of resources exist across other European countries? And we have the same level of support there? Or is it a sort of mixed bag of different experiences in different countries?
As far as I know, it's that we don't have a uniform way of educating patients. Every country does their own bit. And this is where the EU needs to really show leadership in vaccinations and really promote centrally what needs to go out to our patients, because more or less our patients are the same in any country. And therefore, we need uniformity in the EU.
Okay. And so the thing is, the material is there. It's just a question of agreeing on it and then disseminating.
Exactly.
Okay. Thank you very much for that presentation. Let's move on to our next speaker, and that is Bear Oman, who in the Brussels Bubble Circle has become known as Mr. Vaccination because he's constantly pushing this topic. With that, over to you, Bear. Very good, Bear. Go ahead. So, Bear, I think you're on mute or we can't hear you.
Okay, or can you hear me now?
Yeah, go ahead.
Yeah, okay, well, thanks. Well, it's really a privilege to be here all with you. It has been, it took a very great preparation time to have this webinar. I'm going to speak a bit about the work of ESNO related to vaccination, and as also George explained, that we try to expand professional expertise, and it's not just a straight line. You have to go through a lot of curves and influence politics and also politicians. But I give you here a kind of a scope what ESNO is doing. Um, I have to do this way. Hang on. There he goes. This is a bit of myself, executive director in the Netherlands, frequently in Brussels, retired but a proud man to be in this nurse community, and declaration of non-conflicts. About the presentation, I'm going to talk about a bit about nurses' focus group on microbes, and I'm really pleased to say that they are my colleague friends. Because if you know them over the years, you're getting really good friendships, colleague friendships. But it's also with our other stakeholders. So I met George many times, and we see each other often, with other stakeholders, and that's very relevant just to be a very strong network. So we also work with the pharmacists and have good relations with it. So we have to work in collaboration. We also like to see a kind of a programmatic approach. What's your vision? How do you look at your position as nurse related to vaccination? What's your mission? So, but then also see, well, what is your standard? What's your standard? And one of the elements is also to do something, to create something. And that's also what I'm going to explain a little bit about a video what we created, and um, and also what's next. There are always new steps. Oh, there's the other way around. Okay. Well, why focus on vaccination? If I look at this, if I go to meetings, it's often sometimes a bit too much the same, where people say, well, what are you going to do about nurses? It's not about the call of action for someone else to do it, who's often not there. It's our responsibility, and we have to reply and contribute. We also see there's a kind of a medical dominance, or the medical dominance is also given to the medical dominance, and nurses are sometimes too modest. So we have to be more coming coming forward and becoming more present. We have also see there is a kind of an absence on confidence to talk about vaccinations. Sometimes there's a little bit of a fear on how shall I talk. So that's also a bit of the aspects what we really need to do. We also see the mission letter of the of Ursula von der Leyen. And there's a lot of in this related to support from the European Commission on vaccination and including AMR. But also what driving me just is on this vaccination activities is what I also sometimes see is the misinformation, and that's hang on, that's also a bit. People say, well, I like to see the natural immunization, so why should I vaccinate? But we have learned that it doesn't work. We cannot go back to the 1800s before the vaccinations, because we it doesn't work like that. So what is the ESNO response? Is to have an impactful vision. So we need to say to accept that vaccination is one of the most effective preventive health measures. Nurses play a critical role in education and combating misinformation, and our goal is also to harmonize standards of education and vaccination and increase the competences. And it's also what I like to see and also work in the future with the documents George just shared. So we don't have to invent the new wheel, but we must have to make this as a kind of a European standard. So to overcome that every nation is doing their bit, so we have to be more in the European scope. So what's our programmatic approach on vaccination? Well, let me start with that we have a very strong microbial focus group with a lot of key members, and we are divided, and we have four domains. It's infection prevention control, so we're working on a Springer book on the infection prevention control. We created a nurses communication guide, so these are very good guides and very understandable, very accessible. Then we also work with antimicrobial resistance and stewardship. And that's also sometimes I see the word stewardship, and sometimes also think maybe we also should use the term vaccination stewardship. So that might be also interesting. And here you can see what an element is here, and that's the vaccination domain. So we created this nurses communication guide, which is already available. We like to work on a nurse curriculum on vaccination, but then also in European context and using already existed materials. We created a video on the technicalities on vaccinations, which I'm going to show you in a minute, and will be officially launched in the European to the European Parliament members the 5th of November in Brussels. And we're also going to work on a special book on Springer on vaccination. And beside that, you can also see the column on advocacy and engagement. So it's also important just to be a part of EU projects. For example, on professionals, but would also within the with EU granted um, project and programs, just to connect with them. We also connect with the private initiatives, but also participate in alliances. And I'm very proud that we're working with a very strong leaders group. So here you can see the leaders, which are experts from a diversity of European countries. And around that circle, there are more of this. I also see, for example, in our list, Eva Wallace, and I want to give her a lot of credits because she's also has been very active in our network because we did also a video on infection prevention. So there are our community is much larger than this. So on the nurse curriculum, um, we have created a draft, which is still in process, and we do expect it will take some years just to have it fully adopted. But the foundations has been laid down, and we are now in a stage two and consulting our experts and also to make it more consistent and also more ready for the European context. So that's a comprehensive curriculum for nurse professionals, and the impact we aims to enhance professionals' development and competency for nurses and vaccination. So it's the content is on the nurse curriculum, and the fundamentals on the vaccination science and best practice. So it's not only about the vaccination, the administration, but the contextual thinking. And oops, there we go. So in the chapters we have different kind of elements, but they're not complete yet. Um, so we need to have also, for example, the introduction on vaccinology or microbiology, is also giving a historical context, and we also need to to learn each other about the epidemiology. We see a lot coming by. For example, the monkeypox. It's in Africa, but now also now entering in Germany. But we also see some others. So these are the this is the first overview on what we envision to put in this curriculum. And now I want to give you of the first launch of a video what we created. So with support of Viatris, we were able to create a 3 sections video. And the first video is on the preparation or the stage before. The second one is on the actual administration, and the third one is on the activities after the vaccination, so the aftercare, but also the administration. And the purpose is to have clear and practical instructions on the real world applications. And may I invite the technical team just to open up the video because we have this ready for you to show. And this is to Roy.
Welcome to this video on the technical aspects of administering vaccines for prevention. In this first video, we'll focus on the preparation phase, including safety protocols before the actual injection. It's important to remember that regional and local guidelines should always take priority. Following protocols on vaccination literacy ensures accurate, safe, and effective communication about vaccines. It promotes understanding of vaccination benefits, addresses concerns, and helps prevent misinformation. Adhering to these protocols also builds public trust, supports professionals in case of issues, and promotes informed decision-making, contributing to successful immunization programs that protect individual and community health. The information relates to personal data needed for the medical record, such as name, date of birth, and the vaccine's batch number. This information is crucial for tracking any problems related to unwanted side effects. Put the patient at ease and communicate normally in a friendly manner. Appreciate their presence and behave in a direct, convincing, and respectful way. Proper storage is essential to maintain vaccine effectiveness. Most vaccines need to be kept between 2 to 8 degrees Celsius in a temperature-controlled environment. Some require freezing or protection from light. Incorrect storage can compromise the vaccine's potency and safety. Regarding preparation, requirements vary. Some vaccines come ready to use in pre-filled syringes or single-dose vials, while others require preparation, such as mixing powdered formulations with a diluent. These steps must be done carefully to ensure proper dosing and effectiveness. In short, correct storage and preparation are vital to ensuring vaccine effectiveness and patient safety, supporting successful immunization efforts. Although most patients are generally comfortable with vaccination, effective pain management remains a key component of the process. The World Health Organization has established guidelines to address and reduce pain during vaccination. These guidelines are essential for managing the complexities that can arise during administration. Understanding and implementing these guidelines help minimize discomfort for patients and improve their overall experience. By being aware of and applying these WHO recommendations, we ensure adherence to best practices while providing compassionate care. This approach enhances patient satisfaction and supports successful vaccination efforts. After all, integrating pain management strategies is crucial for improving the vaccination experience and addressing any complexities that arise during administration. Review protocols and training, accurate following guidelines, and ensure correct documentation. Implement effective communication. Thanks for watching this first video. The next is on the actual administration intervention. This video was made possible with support of Henelux and Fine, thanks to Viatris. This was an ESNO production.
Okay, well, thank you. I see that I will open my video back again. Hang on. My slides. Sure. Okay. There am I back again. Well, thanks for watching. This is the first one where we showed. On my computer, I saw it not very well streamed. But I'll put in the chat the link to our website where it's already available, but also on the ESNO Nurses YouTube channel, so you can see all the videos on this portal. And so, next slide. So there's a bit of a hiccup. Okay, here it is. Okay, so what's next? This is my last slide. So what we need to do now more, connect with our stakeholders and work more on constituency engagement to make this our program a success. We are exploring contributors for the Springer book we are going to start in the next year, and explore also EU grant on this context. So this is all, and thank you for your attention.
Thank you very much, Bear. It's certainly a lot going on. Thanks for your continued promotion of the importance of vaccines and the importance of the nursing community to promote them. So thanks very much for that. We'll come back to you with some questions towards the end of the webinar. And if there are questions from the audience and you'd like to participate, you're more than welcome to. I think we're going to just show a quick poll now. So if Anna Mitra, if you can just put the poll up, and then so we'll get the questions out to the audience. And while we have that poll running, I would like to introduce our next guest, and that is Rebecca. But so we have the poll now on the screen. Nurses' role in vaccination. How would you respond if a person says no when they want to be vaccinated? Would you start a conversation to explore their concerns? And would you respect their decision and leave it as it is? To be honest, I don't know what the right answer to this is. So please let us know what you think. If that poll is working, it should be in front of you now. If you can please fill out the full poll, that will be fantastic. And so while we have that running, let's move to Rebecca Moore, another expert on vaccination and a European leader in many fields, but with a particular focus on women's health. So it's important to introduce this dimension to the discussion as well. I think, Bear, you'll be sharing the slides. And over to you, Rebecca. How's life, Rebecca?
Very good, Paul. Thank you very much for that kind introduction. And I really want to thank ESNO and especially Burr for allowing us this platform to talk about the role of sex and gender in vaccination. It's for us an obvious area, and it's not that obvious for everyone else. So we've been talking about it for the last 30 years, basically, with the European Institute of Women's Health. We've been based in Brussels for that long, and we've been promoting evidence-based research in healthcare with a special view on gender equity and the role of sex and gender in medication in healthcare. But we have this special interest in vaccination because it's one of the most effective and equitable forms of public health. So just next slide, please. So I'm not going to have a long deck of slides. I just wanted to bring out a few key points to keep it more informal and just discussion points. So within vaccination, the differences that we've found in various research projects we've been involved in and what we've been advocating for this long time is that there are biological differences. For example, even back in 2010, the WHO came out with a report called Sex and Gender and Influenza, where they were showing that vaccines rate and effectiveness and safety and efficacy was not disaggregated. The data was not disaggregated by sex, and that there are major differences in outcomes with regards to influenza due to the response in the immune system that varies between men and women. And there's also an effect in immune response to the vaccine as well. And this can be seen through the fact that females report worse reaction when they receive the vaccine. This is partly because of pain sensitivity might be higher, and also a higher likelihood for women to report side effects than men. But it's also that the dose might be too high in women than it is to men. But there's a positive research in this area, and this is what makes it so difficult. And this partly stems from low participation in clinical trials, that goes as far back as the 1960s and the thalidomide scandal, that women were ever since not represented the same way as men in clinical trials. And this causes an even bigger problem in vaccination and pregnancy, because there's even less clinical research data. And we saw this problem during COVID, where pregnant women were part of the vulnerable groups, but vaccines were not tested on pregnant women. So they had to get vaccinated last, basically, and without any guidance. And since this is ESNO's discussion, we need to come back to healthcare workers here, because for them, this is an even larger issue. With the lack of research, how are they going to be confident in giving advice to patients, which is the best approach to take, especially then pregnant women? And I just want to echo what George Cassiano said earlier, that well-informed healthcare workers, they are vital to counteract the anti-vax movement, for example, because this insecurity, it can feed into the distrust of the vaccines and misinformation, and also deliberate disinformation, which is one of the biggest challenges we have with vaccination at the moment. So putting aside then the biological points, the gendered issue, then what we always advocate is a life course approach to vaccination, that you have these different times in a woman's life where you can reach her. So pregnancy, I mentioned pregnancy earlier, but it is a time where there's a lot of contact with healthcare, and women are encouraged to take vaccinations during pregnancy. Then you have the early years, when it's usually mothers that do bring their children to get vaccinated. And so it's a great opportunity to talk to women about the importance of vaccinating their children, ensuring that we reach the levels that we want to have in vaccinations. Then, during midlife, you have women being the main carers for elderly parents. They're called the kind of squeeze generation, we call it. They have children and they have their parents that they have to look after as well at the same time. And they are the ones that are most likely to be bringing their old mother and father to doctor's appointments. So again, as carers, they can be instrumental in helping out with vaccination. And then on top of that, we have old age as well. So Europe has the proportionally the highest rate of older women in the world, and women live on average 6 years longer than men, but in worse health. So you have this added complexity then with multimorbidity and vaccination. And so again, older women are even less represented in clinical trials. So this causes, again, a bit of insecurity. But what we need to try to do is to change the narrative and see vaccination as part of healthy aging and part of a wellness strategy, rather than something only for vulnerable people at old age. And within this, we have to have easy and affordable access to vaccines. We need health literacy, and even more specifically e-health literacy these days, because so much is online, and this is important to reduce barriers. And we have this intersectionality with women and vulnerable groups that are usually underserved as well, that there are different sociological and economical factors that can make women especially vulnerable for this. And for example, Gavi, the Global Alliance for Vaccine and Immunization, they have gender equity as an overarching principle in all the work that they do within vaccination. So again, we can also include chronic disease patient organizations, but also women themselves, to target them with the messages and the communications we need. But healthcare workers, and especially nurses, then are really the group that can help, and reaching the goal will be healthier and better outcomes with a gender lens towards vaccination. So that's my main points. And the final slide is a thank you. And if you have any further questions, we'd be happy to help you.
Thank you, Rebecca. I mean, for me at least, it's a new angle on vaccination. And I was wondering, going back to just the earlier part of your discussion, if we're saying that women and men are different, and that has implications for things like vaccination doses, how do we address that? I mean, are we looking at researching whether different doses are appropriate for men and women? Where's the current state of the research on that question?
Well, ideally, that's where we'd want to go. What we've been advocating for years is to have disaggregated data in research trials, and to have equal representation of women and men in research trials. And that goes for all medication, not just vaccinations, but that's a good start. And there are policy in place for these, but in practice, it's not that easy to do, and it's not happening at the speed that we want to see. But raising awareness about this at the EMA and in America in the FDA is just what we have to keep doing.
Okay, and so when you say that there are examples of where this is happening, are you talking about with respect to the way that the research is done and the way that the trials are done? Okay.
Yeah, exactly.
Okay, fine. But really, we need that first before we actually get to the question of different doses for different sections.
Exactly.
Okay, very good. So this is very much a long-term project for you. I mean, how long have you been advocating on this? Are you talking? Have you been addressing this topic for the past 30 years?
Well, I haven't been with the Institute for 30 years, but the Institute has been working on it for 30 years. So yeah, it's a long-term project. But what we're very happy to see is that women's health is having a bit of a moment at the moment, which is brilliant. So now it's really the time to tighten the screws and get people working on it, because people are waking up and realizing, even economically, the effect it has and the wider implications. So it's really a good opportunity to do the work that needs to be done.
Okay. I hope that it won't have to be an economic argument that will make this work. I think that the woman's argument on its own should be enough, right?
I know.
Okay, fine. But okay, maybe we need to be pragmatic too. Okay, fantastic. So let's have kind of open discussion about this. I'm hoping that people in the audience will join this as well. It takes one brave audience member to enter into the discussion, and then everybody feels comfortable joining as well. So who wants to be that brave audience member? Put up your hand, join the discussion. But I'm going to go back to George first. George, so we're talking about nurses playing a very important role. I know you mentioned pharmacies as well. I mean, there's all sorts of healthcare professionals that can play a role, but we're just talking about nurses. And when we're talking about nurses, I find that at ESNO, there's a lot of questions about, a lot of discussion about nurse leadership, nurse autonomy. And how do you think that discussion feeds into this discussion about having nurses being at the front line of ensuring that there's more communication, promotion, awareness about vaccination?
Well, training in vaccinations is very, very important. And for infectious diseases like influenza, there is a need for anybody who vaccinates, including the nurses, to actually have a training every year, because vaccines do actually change every year. They're not the same as the previous year. We need to set standards in the EU, and the vaccinators need to meet actually those standards. But I think above all, Paul, is the acceptance of the nurse as the main vaccinator. We are really far away from accepting the nurse as the main vaccinator. There are countries, in fact, at least one country in Europe where the nurse doesn't vaccinate, it's the doctor that vaccinates. Well, if we were to do that in the UK, forget it, we will achieve hardly any vaccination rates.
Yeah, and does that come from public perception, or is that a kind of a top-down thing about the position of doctors and nurses within the healthcare ecosystem?
I couldn't tell you because I haven't done the survey, but I can suspect it's top-down.
Okay, it's a top-down approach, which needs to change just for the sake of better public health outcomes, if not anything else.
Absolutely. Absolutely.
Okay, okay, very good. Can you tell me a bit? I mean, I mentioned UK versus Europe. Can you tell me a bit about the global initiatives that you're involved in and how you see that part of your work evolving?
Well, personally, I'm on the ESWIT board, and the European Scientific Working Group in Influenza does a lot of work in promoting prevention of infectious disease, especially respiratory infectious disease. I also chair a pan-European group of experts, it's about 20 countries, called RAISE, which stands for Raise Awareness of Influenza Strategies in Europe. And we have introduced a flu plan for Europe, and we have done a lot of meetings, a lot of papers out, really supporting improvements in the vaccination rates in Europe, which generally for influenza are really generally very low. As I mentioned earlier on, in the EU, only 2 countries, Denmark and Portugal, really achieve what the WHO target of 75% and above vaccination rate for the 65 and above, the older adult. But also, it is actually the target of the European Council, not just the WHO. And we have not achieved it. There are countries who are right down in their vaccination rates. And what I see is the fact that the ECDC that has not published any vaccination rates since the influenza season of 2020-21. Why? We need those vaccinations rates. We need a healthy competition, if you like, between us. If my country is right low, I need to raise it. If my country is high, I need to stay there and go above. So RAISE has actually put forward as 90% target and a minimum of 50%. We are kilometers away from achieving this target in Europe.
Why do you suspect that they're not publishing that data?
I couldn't answer the question because I am not privy to the reason, but it is a fact that we have not had vaccination rates coming out of the ECDC when we should be having them every year. It is very important we get them.
So a sort of a leaderboard, a Premier League of vaccination rates to see where everybody stands, and this can only spur improvement.
Indeed, but above all, we need to introduce uniformity in the EU, because preventing infectious diseases in Romania is as important as in Cyprus, where I come from. And in Cyprus, it's as important as Romania. It's the same anywhere you go in the EU. Therefore, we need to get the EU to lead on uniformity in Europe. And one of the things we need to introduce is the nurse to be the main vaccinator, because the nurses do such a much better job than anybody else you can think of. Pharmacists are coming in now, and I very much welcome that as well.
Okay, okay, very good. That's very, very clear. There's so many things that you could pick up on there. But let's focus on the role of the nurse within the healthcare system. It seems that recognition is an issue here. Now, I don't want to ask you as a representative of ESNO, what more can you do? Because I think you're doing more than enough already. But what needs to happen so that recognition can take place? Because here we have a very concrete example of poorer health outcomes as a result of the position of the nurse within the health system. Go ahead, Bear. You're on mute.
Well, first I have to say hello from our president, but he couldn't join, so I was to bring him bring a message to all that he was very much welcomed you all, and he's very pleased to see with the presentations. On your question, it's for us as nurses, it's broader, even broader. You see, after COVID, we saw a lot of healthcare professionals in a very difficult situation in the recovery stage. And we saw also a lot of health professionals just leaving the health domain. But we also see some new arrivals coming in, but still an overall the the culture of narratives shows that nurses feel more like being an instrument, a pawn, rather than an actor
Yeah.
as a full engager to be an answer on the whole puzzle.
So,
And
is it like they feel like they're being told what to do? If the policy is
yeah,
nurses involved in vaccination, they do it. If not, they're left out, and they don't have a really say in this.
yeah. For example, we did a survey and it said, well, what's the main issue if you have hesitancy on vaccination, or what's if you have a kind of a negative approach to vaccination, what is it? And then the overall response is say, well, they do not matter about my voice. I do not. I'm not a part of the puzzle. I'm not engager. So it's even when I'm now retired, and it was just short before my retirement was right into the COVID. That in the hospital where I worked, and I said, well, why don't you put nurses in the key role on the whole vaccination? And they say, well, no, that's the point of the whole issue. It's now on the medical hands. You just do what you're going to be told to,
Okay.
and that's all. And that really needs to change because it echoes a lot of other domains. So we strongly believe that with education, involvement, their autonomy, it not only contributes to the vaccination knowledge, but also competence, but also the context. When they feel more as, then they also become advocates, and it also will contribute to their retention. That they can say, I'm a true member of the interdisciplinary context. And that's also a bit of why we want to set this issue in the curriculum is about management.
I
So,
got it.
yeah,
So I think this is clear to me. I'm sorry that to cut you off, but we just have 3 minutes left. I want to make sure that I get Rebecca into the discussion as well. Rebecca, sorry that I don't have so much time left, but just very quickly, when we're talking about the role of women and the influence on women's health outcomes, is there a role for nurses here? Can nurses be an advocate for women with respect to some of the questions that you brought up in your presentation?
Oh yeah, hugely. Well, first of all, nurses are women, so they can be advocates for themselves as well, but hugely. I mean, specialized nurses, say in areas such as midwifery, they're hugely important. They meet the pregnant women, so they can do it. And also pediatric nurses, when you're talking about meeting women vaccinating their children, it's hugely important for us as women's health advocates to have nurses on our side, and that we can work together with them and highlight. They know firsthand the importance of women's health anyway, but there is just incredible amounts of synergies that we could work on together with them. So, and again, as carers, healthcare workers, carers, everything, it's just, there is overlaps in so many of the sectors.
Okay, fantastic. Bear, I guess you'd agree with that.
yeah, absolutely. Thanks. Yeah, yeah. I couldn't add too much more on this. Yeah.
Okay, perfectly. Okay, so very interesting. George, would you agree with Bear about this kind of change that needs to take place in respect to more recognition for nurses?
Yes, I do think that the EU needs to accept and promote the role of nurses in vaccinations, and also individual countries need to do so. But at the same time, we need EU standards in immunizations that we need to adhere to and train everybody towards that.
Yeah, okay, very good. Bear, why is it so difficult for the EU to implement those standards on such a critical topic?
Well, there's this called this subsidiarity, and that every country is responsible for their own health. And it's very sad to see that it's often used as a bad excuse not to act. You see, we have the European Health Union now, and that's an ideal instrument. Also, not only talk about the preparedness on new medications or the access of, if you have a new pandemic, that we have harmed, that we have a good collaboration on the development and the distribution of equal of the equality on new vaccinations, also in the procurement. There's a lot going on, but why not the professionals? So I think there would be an ideal opportunity or a window opportunity in the European Health Union, just to create a kind of a mechanism, even just to discuss it. And last week we were in Brussels at a meeting on the influenza awareness day, the 16th of October, and I was very pleased to be there. And so that's where you see all the actors in the Brussels bubble. So um, I strongly believe that we should be more on this. We also had the representative of the chair of the European Commission, HERA, which is discussing on the preparedness. But you see, we have to close this gap somehow at European level, and we need to create a mechanism that we can just discuss it within the European mandate coming up after the hearings. The new Commission. I hope that the new commissioner will also recognize the value of the health professionals, maybe not under recognition, but at least that there will be a forum where people can discuss and they meet and on this on this preparedness. So we need to have some courage from the European Commission, and I also hope that members of the European Parliament will trigger this courage because they have the ability to do this.
Okay, very good. So if it can't happen at a regulatory level, then it's something that can be done among healthcare professionals themselves. Is that really what you're proposing?
Yeah, well, sometimes I think that the healthcare professionals, the NGOs and the alliance, they are done their homework. They do very much work, but there's
Yeah.
this gap between their good intentions. They're very well established. The science is there, but then is the implementation, and there you have to cross this. We have to cross this bridge somehow. And I also think that the ESWI, and I also see Michaela, she's the leading of the European steering group of the European working group, scientific working group of influenza. She's very active on this on a different level. So I think we should be more vocal on we should be more vocal on this because um, the uh, the mandate has not been set yet, but and the hearings they start at 6th of November. So we need to have that our politicians are going to raise this issue so that it's within the European Commission's mandate to create this kind of a forum.
Okay. Now, when we're looking at the vaccination rates, and we're looking at, let's say, the countries that are doing well, like Portugal and like Denmark, and this is maybe a question for you as well, George. Has there been studies on whether there is a link between countries that do well with vaccination rates and the involvement of nurses and healthcare professionals beyond doctors in vaccinations? Has that research been done?
Not to my knowledge, and it's a good research to actually undertake. One thing that RAISE has actually looked and put out was the fact that where you have low vaccination rates in influenza, you also have low vaccination rates in COVID-19.
Yeah.
They go together. So it's the campaign for vaccination that really needs to be sorted out in Europe. And of course, it is very important to understand that the nurse has the ear of the patient. The nurse is trusted by the patient. So if the nurse is well informed about vaccination and well trained, then the nurse's recommendation is a strong antidote to any degree of hesitancy by our patients to get vaccinated.
Okay, now, is vaccine hesitancy something that's growing? Are you involved in measures to counter that? And is this part of the reason for the low level of vaccination rates? Is it possible that the situation might get even worse as a result of these type of cultural trends?
In the UK, we have measured the vaccine hesitancy because, as you know, we have a national IT system in general practice in primary care, and we record when the patient refuses vaccination or so. And not the last season, the season before, and last season there was an increase by about 2-3%. So about 10% of our patients actually are hesitant about receiving the vaccine. But also, we have a problem with vaccine hesitancy because we're using the word vaccine hesitancy. And when I talk about vaccine hesitancy, my glass is half empty. On the other hand, when I talk about vaccine acceptance, my glass is half full, because those who are hesitant, it's not that they have refused the vaccine, they may or may not get the vaccine. Is the vaccine refusal that will refuse the vaccine, but the hesitant may actually get vaccinated. It's up to us how we approach this. And the question you put for us to answer actually has quite an element as to how we should approach a patient who has not as yet decided to get vaccinated or not.
Is part of the discussion the fact that influenza is not taken as seriously as it should be? I have to say, from my own perspective, I don't get a flu vaccine. Because I'm not seeing this, I think, like many people, as a very serious health threat. So am I completely wrong about that?
Yes, you are. Because influenza can it can be severe. You may need to be admitted to hospital. You may go on to a ventilator. You may lose your life because of influenza infection. Very recently in the UK, there was reports of a female patient in her 30s that actually was admitted to hospital. It was influenza and died. So it's not just the older adult that dies. It's not just the very young child that dies. Any age can actually have complications from influenza. And it is a disease that generally, overall, we can actually prevent by vaccination. And the more people we vaccinate, the less of the virus actually circulates in our community. And children are very important because they do suffer from influenza. They are admitted to hospital. Some of them will lose their life, but also they're the most efficient spreaders of the influenza viruses. And this is why in the UK, last year and this year influenza season, in September, we have been asked not to vaccinate adults, vaccinate feverishly children, and in October, start vaccinating adults. Why? Because in 2022-23, we had a bell of infection from influenza.
Sure.
And the year after, we were asked to vaccinate first children in September, and then adults in October, and that bell was flattened. Why? Because that's where the transmission of influenza really occurs a lot.
Can you tell me something a bit about just the evolution of the vaccines themselves? Are we looking at a much greater capacity to prevent influenza due to the developments in vaccines?
Well, back in 2018, the JCVI in the UK told us that we have a problem with the effectiveness of the vaccines, particularly for the AH3 and 2. And there were 3 reasons why we have that. One is antigenic drift. What can we do about antigenic drift? Send more respiratory swabs to our public health so that the WHO has better information. The second was immunosenescence, which is not at 60 or 65. It starts from about 50 years of age onwards. How can we combat that? We do 2 things. We increase the amount of antigen in our vaccine, or we add an adjuvant. And the third problem was egg adaptation. When you put the virus from the WHO in the egg, the virus tries to change to grow better in the egg. But what you get out is not the same what you put in, not always. And that's called egg adaptation. So produce vaccines that don't use eggs. And we have done that. We have got the recombinant and we have got the cell-based vaccines. So we have done a lot in technology to overcome the problems we see in vaccination. Still, we need far more effective vaccines in influenza.
Okay. What is your position on the discussion that we had with Rebecca about difference in sexes and the implications with respect to potentially looking at different doses for different sexes?
I couldn't comment on that because I have not really dealt with this problem. I doubted whether we need different doses for different gender. I doubt it. But it's something that I couldn't say. For ages, yes. For example, if you take the COVID-19 vaccines, the dose for the 4-year-old is not the same as the dose for the 65-year-old. But for influenza, generally, we had one vaccine for all, but different ages. For example, it can be licensed from 18 years and over, or it can be licensed from 2 years and over, or it can be licensed from 6 months and over. So age does play a role.
But that's based on the research that has been done, trials that included people of those ages. But surely if we can do trials with different ages, then we can do trials with different sexes.
Yes, certainly. But personally, I'm not really good in being able to give you a good answer on that.
I know, but I think like Rebecca was saying, the research is not there yet. So it's kind of it is certainly a speculative discussion for the time being. Okay, I saw that the poll was there and then it disappeared. Maybe we could get the poll up again. That can work. In the meantime, Bear, we're looking at a new commission. You were talking about the mandates. We're talking about the commissioner hearings now in a couple of weeks. Are we seeing any developments that could give nurses some sign for optimism that some of their concerns are likely to be taken more seriously under this new mandate?
I don't have a clue yet. But let me give a bit of a shift. I see in the participants two very strong leading ladies in our participants.
Good.
And that's Anne Lequeux and Eva Wallace. And I'm not sure if they are interested just to join the discussion, because I know that Eva Wallace, she's an expert on infection prevention, and it would be an interesting angle just to contribute to this discussion. But I also see Anne Lequeux, and she's the past president of the European Organization of Nurse Educators. And
so I see. Anne has gone off mute. Yeah. So maybe Anne, you're ready to join.
Hi, Bear. Hi, everybody. So hi. It's I would speak in the name of FINE, European Federation of Educators in Nursing Science, and it's very important. And thank you so much for your different intervention, and we are very interested to work together because vaccination is a very important domain, and I think it's not really present in education at this time, and we have to work in that way. There are a lot of competencies and also an interdisciplinary context, as Bert told us, and the difficulties to implement the standard for nurses we know about at the European Commission, but we hope really that we can have a good collaboration and working together with the new Commission. We have already some contacts, and I think it will be very important to work with FINE, with ESNO, with other stakeholders, and to have a united voice. And that is important for the European Commission, if we have a united voice to work at in that way.
Well, so, go ahead. Keep going.
Hello?
Yeah. Keep going. Sorry, I interrupted you, but you're in the middle of speaking, so please keep going.
Okay. So I invite you to participate in our next Fine Europe conference in December, 5 and 6 of December, in Luxembourg. It's organized by Fine Benelux Belgium, also the National School of Health in Luxembourg, and the University of Luxembourg. And there I will send you the program. And I think the theme is meeting healthcare needs through nursing education in Europe.
Wow.
The health needs of today's and tomorrow's population. How will or should nursing education evolve in Europe? And what are the prospects for career development? And so I think it will be good if somebody of ESNO will propose an abstract for during this conference, two-day conference. And about vaccination, of course, and the theme you explained today, it's very update for that kind of intervention. Okay. And then we have some table to discuss together. And so, what do you think?
Okay, I think it's a very, very important topic. I think we all need to be in Luxembourg 5th and 6th, is it, of December? Bear, you want to come in?
Yeah. I already see in my WhatsApp that our junior policy officer Panagiotta is scheduling a trip to Luxembourg around these days. So, but I'll share it anyway, Anneleke, and it's really, really an honor for me just to have you in our group. But I also see Eva. Yeah.
But I just have one question for Anne. So is what you're saying that the topic of vaccination is not sufficiently a part of the nurses' curriculum?
Yes, really. And not only in my country, in Belgium, but we are looking in a work group of Fine in the different countries. I think in Portugal, they have some information about scientific information, but not really an engagement of the nurses to work in that way. You understand? Because we have to be coherent. If you go on and if you believe that vaccination is essential for all the people in the future, we have to be coherent in the education, you know?
100%.
Thank you very much.
Thank you very much for Anne, and thank you very much for sharing the information about your Congress. Let's move to Eva.
May I add something?
One last thing, please go ahead.
So, Bert told you that I was past president. I'm a member of advisory board of Fine, but I'm also advisor by WHO, and I think we have to share with them, you know, because it's a domain, very important domain of the work also of WHO for the healthcare.
Okay, well, thank you very much. We will work on it. I'll contact you back later on again.
Okay.
But maybe can I invite also Eva Wallace? I see she's in the car. Is that correct?
I thought it had finished at 1 o'clock. Well, I actually just tuned in just from an interest point of view. I really don't have any involvement at all in vaccination, but what I find is it's fascinating. It's really the same as catheterization. You know, when nurses do it, it's better and it's safer. And you're saying the same with the vaccinations. It's all about education and training. And what I think is really lovely is the fact that you're trying to get a uniform policy throughout Europe. So as every nurse does the vaccinations the same way, they do their catheterizations the same way. And I suppose I just represent the EAUN, you know, from the European Urology Nurses Association. And I just think it's really interesting. They are talking about bringing in vaccinations to prevent urinary tract infections. And that will be another area that would be covered as well by vaccinations, you know, on a long term, I think down the road a little bit. But things are changing, and I think it'd be super to have just the same policy in every country in Europe. When people they did it with COVID.
Yeah, and so Anne, are you based in Ireland?
Yeah, Eva, yeah.
So what's the Irish situation in terms of nurses' involvement in vaccination and the Irish vaccination rates?
Well, now, to be quite honest, I don't know because I'm retired and I don't work in that area. But I do know that they have a lot of nurses that are employed just to do vaccinations only. So they vaccinate in nursing homes, they vaccinate in the schools, and they vaccinate the elderly. They actually sometimes, if they're disabled or something, will go to their homes. The nurses will go and vaccinate them. In relation to the GP practices, every GP practice does their own thing, and they just run vaccination clinics for the flu and for COVID. And the policy would be, I think it's over 60s or 65s can go for the vaccination. But if you have any underlying comorbidities or anything like that, then you can actually go ahead as well.
Okay, very good. Thanks very much. Ava, anything to add on that, Bear?
Well, not from not from my side. I'm really overwhelmed with this very well. It's a one way, very convincing, convincing story. So it's
Very good.
the message is getting very very clear.
Standardization is a complete no-brainer. I mean, I think it's absolutely absurd that we don't have it.
Yeah, but we have now a lot of already very good best practices. Also, what George just showed us, and I really want to dig into this. But it would be fantastic, for example, if you're going to the Eastern European countries. We see for Hungary, the status is very low. The nurses have nothing to say, and that we can say that we also see that nurses from Hungary do their basic training. They come, they're going to work in Germany, where the status is not also that good. So we really need to outreach, not just to remain in our own silo that we can say, well, here in Ireland, the Netherlands, or UK, or France, or there is well established, and leave the rest there. So we need to bridge this. Also to those countries to create a stronger self-esteem for the health professionals in this domain, and it could be a great example for other domains. For example, like incontinence, because it's also a very big topic. So
this could be like a success story. We get the standardization in.
I think that this could be a very good success story. Yeah, because yeah, let me stop here.
Very good. Okay, and so the poll keeps popping up, and I think I should finally put that in the spotlight. How would you respond if a person says no when they're asked if they want to be vaccinated? Would you start a conversation to explore their concerns? 94% of the people click this, or would you respect their decision and leave it as it is? George, is this the right response? Start a conversation with them?
Absolutely the right response. When you have a patient that has said no to vaccination, it is important, if they would like to engage, to actually ask them what concerns do they have about vaccination. Listen to them very, very carefully. And when you answer back, answer them with language that they can understand, not the language you have, medical language and all that. No, language that they can actually understand. And do not press on them to take a decision there and then. No, they can have time. They can go home. They will come back if they want to get vaccinated. But our task is there to inform the patient, depart with what we know, and leave it with the patient to take a decision. So don't force a decision on your patient. Never. No, it doesn't work, in fact, and it adds to hesitancy anyway.
Once I
had and it also emphasizes that listening is one of the most important components of communication.
Yeah, I got a great example on this listening. I was a few years ago. I was at the notary because related to association issues, and then the notary said, "Well, we were all finished," and they said, "Well, what are you doing with the ESNO?" So I said, "Well, we're creating a nurse's guide on vaccination." And then she said, "Do you have 10 minutes? Because I have a question on this." So I said, "Well, what's your question?" And then she started talking, only talking 10 minutes, and then she said, "Well, that's strange, but my question is already gone. Only this discussion was already enough for me." So just what you say, Paul, just listening. And it's also very good to see on this poll. Yeah.
Okay. Okay, very good. So I think we're kind of drawing to the close. Sorry, I was suggesting that we were just a 1 hour webinar. In fact, we had more than enough time for the discussion. Unless there are other pressing topics, anything that people want to get off their chest, I think we're kind of in violent agreement with each other on this. I think we know where we need to go. It's a question of that complicated task of implementation across all of the different European member states, but certainly the will is there. I think that education is a very important part of the puzzle as well, and more efforts towards promotion and communication just about these common standards. And I think the videos that we produced, they are available on the website, so please check them out. They can be a good starting point as well. And let's keep this up. If you have suggestions for how we maintain the momentum on this, we would be more than welcome to hear them. And I think with that, I'd like to thank all of our speakers. I think it's been a very fascinating and a very engaging discussion. So thank you to George, thank you to Bear, thank you to Joris, and thank you to Rebecca, and thank you to all of the participants as well. Thanks for tuning in, and hopefully we'll see you all maybe in Luxembourg or in the not too distant future at an ESNO event. So please enjoy the rest of your day. Thank you very much.
Thank you.
Okay.
Thank
Thanks,
you.
everyone.
Yes.
Bye-bye.
Bye-bye. Thank you.
Thank you.